Hey, thanks for making it to Veterans Info Tap. I'm glad you made it. The VA has made an announcement, and I wanted to share it with you. Before we jump into it, I want to throw on a special thank you to Frank Nitty. Frank Nitty, thank you so much for the super comment, super chat thing. I really do appreciate your support very much, Frank. Thank you. All right, so jumping into it, this was out on Newsweek not that long ago, and I wanted to share it with you here today. It came out July 24th, 2025, and again, sharing it with you now. Please hit the thumbs up, subscribe, share with a friend, all that good stuff. I really appreciate it. Every thumbs up, every minute watch really does help the channel. If you want to support in other ways, consider being a member. Thank you so much to all you members. I do my best to get back to you in the comments. All right, so the headline is VA announces improved funding for veteran health care. That is a big deal because everybody was worried that there was going to be these massive cuts, not just employee cuts, but also funding cuts. So VA announces improved funding for healthcare. We're going to dive into that. If you do not have VA healthcare, either you've just never signed up for it, or you're not service connected, or you don't meet the specific qualifications because you're not service connected yet. Really, if you're one of those guys or gals out there that are thinking to yourself, well, save it for somebody else, I'm okay, I can still walk, go have a conversation with either an accredited representative out there or an accredited service officer, somebody, and really consider moving forward with your VA claim. Now, if you can't find a credible and competent VA representative that's accredited, we're happy to help you here. Evidence-based VA claims. I'll put the stuff in the description and in the comments for you to reach out to us if you need that type of help. All right, so with that, let's jump into it. The Department of Veterans Affairs has announced an $800 million boost, so nearly $1 billion, $800 million boost in funding for infrastructure improvements across its healthcare facilities. I will tell you this, that has been really something that has been needed. There needs to be a lot of money invested, I think, into the infrastructure of the VA. Now, granted, there's new clinics and stuff out there. Those are great. There's newer facilities that have been constructed. Those are great. There's been expansions to existing structures. Those are great. But there's also a lot of need still within the entire VHA, Veteran Healthcare Administration. So let's move on. On Wednesday, the VA revealed plans to realign an additional $800 million to VHA, the Veterans Healthcare Administration's non-recurring maintenance program during the current year. Why it matters: across the U.S., there are 1,380 healthcare facilities, including 170 VA medical centers and 1,193 outpatient sites, serving over 9.1 million enrolled in VA healthcare. Now, here's an interesting thing for those that hadn't heard this before. I had mentioned it in a prior video. 9 million veterans in VHA, Veterans Healthcare Administration. Not all of those 9 million veterans are service-connected disabled veterans. The service-connected disabled veterans represent maybe 6 million, right? So there's 3 million plus veterans that are enrolled in healthcare, but they're not rated with the VA for anything service-connected, right? They don't have tinnitus, they don't have a bad back, they don't have flat feet, they don't have, right, that they're rated for. So then the question is of those 3 million, how many of those should actually be service-connected? In fact, really the bigger question is of the 17, 18 million veterans out there, how many of those should be service-connected and how many of those should be getting their care from the VA, right? Anyway, so let's move on. The investment comes amid efforts to modernize VA medical facilities, strengthen accountability in spending, and ensure that veterans receive quality, timely care. The funding increase aligns with a broader push in Congress and the federal government to support veterans' health programs, improve oversight, and reduce waste within the VA system. what to know is the next section here. According to a press release, these funds will address urgent needs across VA facilities, covering projects such as modernization of boiler and chiller systems, which I would say is probably very important, right? Nobody wants to work in a freezing cold place or a hot place. Upgrading electric infrastructure. I have a rooster. All right. I hope you heard it. Otherwise, it's just out of the blue, and then it just really seems weird. I have a rooster in the background. He makes noises. Sometimes I think you can hear him, and I assume you do. So sometimes that happens. All right. Upgrading electric infrastructure, improving elevators, updating heating, ventilation, and air conditioning, so HVAC systems, enhancing fire safety through sprinklers and alarms, renovating clinical and support spaces, and supporting the electronic health record modernization initiative. A lot of things going on. Let's move on. Earlier this year, the VA confirmed that to help reduce wait times and administrative bottlenecks, those receiving its healthcare services will no longer need a second VA physician to review and approve their eligibility to receive non-VA healthcare. All right, that's actually a very important piece, and I hate when they just kind of skim through it and they don't really. What they're talking about is community care. Before, your physician, when you would talk to your physician at the VA and you're like, hey, I'd really kind of just prefer to go out to the public for that thing that you want to refer me to that I have to drive 2 hours to. Oh, okay, they say, no problem, I'll put you in for that. It used to go to another physician somewhere, a supervising physician or what have you, that then signed off on it or went, nah, you can get it done wherever. They took that second part away, and now they just rely, which makes sense, on the physician that you're actually eye to eye with and having a conversation with. So they took that away, so it speeds up that process for community care, which is non-VA healthcare. So it's just the way that they write this stuff sometimes. It doesn't fully resonate, I think, because there's so many nuances for those out there that like the nuances. All right, so in May, the VA announced that some $52 million in funding is now available to support community-based organizations focused on suicide prevention and emergency clinical services for veterans at risk of taking their own life. In a 2024 report, the VA revealed there was 6,407 suicides among veterans in 2022, the latest year for which data is available. More recently, on Tuesday, the VA announced new partnership with the Centers for Medicare and Medicaid Services, which I also talked about in a video, aims to prevent duplicate health care billings for veterans. The VA has identified $106 million in duplicate payments to providers over the last 6 years, and as a result has begun seeking recovery from overpaid providers this month. VA Secretary Collins said in a press release, "This is another step forward in our efforts to make VA work better for veterans, families, caregivers, and survivors. We are charged with serving. Improved facilities, equipment, and infrastructure help improve care for veterans, and these additional funds will enable VA to achieve that goal." I agree, absolutely. The federal department said the new funding bill brings the NRM program spending for the fiscal year 2025 to $2.8 billion, approximately $500 million more than the previous year, the VA reports. So financially, I mean, that's all great things happening for the VA, additional monies to be able to do things. Do I think $800 million is going to be enough for the entirety of what needs to happen? Probably not, but you're probably not going to get all that work done within a 12-month period anyway. So I think it's the right move. I think that it is a focus that needs to be had, and would love to get your comments on it. Thanks for watching. I appreciate you very much. Have a great one. And remember, if we don't take care of each other, something went wrong.